All right, so let's keep tapping on our screen. Let's keep tapping on our screen. Let me see the people in the house. Yep. Sexy V is here. Okay. All right. So tonight we're discussing anatomy scan, and definitely the reason is because we want to know why it is the most important scan in pregnancy. All right. Now you see if pregnancy was a journey, which pregnancy is actually a journey, right? The anatomy scan is that moment you get to stop in your tracks and carefully inspect your vehicle, right, before continuing on that long journey. The reason because you want to be sure is your tire still gauged, is your oil still gauged, is your temperature within normal. You do that inspection and you continue on your journey, or even fill your tank, right? So that's what anatomy scan will represent if pregnancy was a journey, which it is, right? Not because something is wrong. You're not doing that because something is wrong, but because this is the best time to be sure that everything is right. You want to be sure that everything that needs to be in place is in place. Everything that needs to be gauged is gauged, right? We said a lot about what could go wrong in first trimester. So the second trimester or anatomy scan is like doing a second check to be sure that everything is right. Right. So this scan is not about you guessing the baby's gender like many people are always interested in. When people come to me and say, "Oh, I want to do an ultrasound scan. I want to check the gender." The question I always ask, is that the only thing that really matters to you? Because the gender of the baby really is not is not clinically important to us, right? It's important to you, but it's not clinically important. But it sells market, unfortunately, because people would price you more because you tell them the gender. So, but nobody should be denied the gender of their baby if they desire it. But the reason, because of the confusion it causes, so we try not to bother about that. So, like I was saying, this scan is not about guessing the baby's gender or admiring the tiny fingers, even though those are moments that we allow the mothers to enjoy anyway. But this is about how the life is being built. Remember, first trimester is about the laying out the blueprint and the foundation. So now we're no longer laying down blueprints. We're no longer laying down foundation. We are actually inspecting the progress of this building. Yeah. So that's what's going on in second trimester. So why is this scan done in the second trimester? Why? Before we answer that question, I want to be sure that those that are listening to me are here and they are paying attention. So if you are here and you're ready to go in depth, please just type ready so that I'll be sure that you're here. Is that okay? So while you are doing that, let me just shoot a flare so that I'm sure those that are pregnant or trying to conceive who are online, they'll be able to see us and benefit from the discussion. All right, I'm sure somebody out there will see us benefit. All right. So why is this scan done in second trimester? Why? All right. Now, by 18 to 22 weeks of pregnancy, the baby has actually reached a very unique stage. Yeah. Is that Kemi Ons? I see Kemi Ons. Is that you? You're welcome. Good to see you. So I was saying that 18 to 22 weeks of pregnancy, the baby has actually reached a unique stage where the organs are fully formed, right? So if you've been following me from first trimester, you already understand the things we discussed. So at this stage, the organs are fully formed. The structures are large enough for us to see clearly. Yeah, the growth pattern has been established. This is not the time to second guess whether is it growing or is it not growing now. The growth pattern is established, and the placenta at this stage is functioning. Now, before we got to this stage, right, the structures are still too small for us to appreciate, even though it was being formed, right? But now that we are in this stage, it's clear enough for us to see, and if there is a problem, we can now deduce that okay, there's a problem. But earlier, you could not really tell because the structures are small. That's why it's a global concession that this window is the best time, right? It's a perfect time to look closely if there's any physical or structural abnormality that is occurring with your baby, right? So when this is done, the question is, okay, I asked the question the other time. If you're here listening to me and you're attentive, please type ready in the comment section. Let me be sure. Even if it's just one person, I'm good to go. I didn't see anybody type something, so that may mean that nobody. Okay, apart from Husna Moms TV. Good evening, Husna Moms. How are you? Good to see you. You're welcome. Right? Okay. All right. So we'll continue with our gist. So what exactly is the anatomy scan checking for? What exactly? Is it just for show? Or there must be a reason, there must be something the anatomy scan is looking out for? But again, you want to think of the scan as a full body inspection from head to toe. That's basically what that scan is all about. Looking at inspecting your baby from the head to its very toes. And that is exactly what we're going to do in this discussion. We're going to start discussing from the head to the very toes. Let us see what your doctor, your radiographer, or your sonographer is looking at, and what they are trying to deduce, right? Now, let's start with the brain and the skull. This scan, remember, is a full body check, and we're starting. Is a step-by-step systematic inspection of the body. So that's what we're going to do. So I'm starting with the head, the brain, and the skull, right? And this scan checks for the shape of the head, right? It checks for the shape of the head. It also checks the brain cavities. It checks the brain cavities and the midline structures. There are several structures that is there to be seen. Now, I have some images at my background which are not so clear, but don't matter. It doesn't matter. If you notice up here, you will see something like the head, the topmost area, something like that. So these are part of what we look at. While you're excited about getting the gender, we look far beyond that, because the gender is not really our interest. The physical completeness and well-being is actually what we are interested in. The reason why the brain and the skull matters to us, because some brain conditions begins very early. Some brain conditions begin very early, and early detection can actually guide the care and the decision making. So if, for example, something is seen that is abnormal and your doctor is informed, the decisions and the care the individual will receive will be more intentional than when they are just taking care of the individual blindly. So that is why it matters when we look at the brain and the skull in early pregnancy. Then, having looked at the brain and the skull, we now move to look at the face and the neck, right? Yeah, we do all that. Look at the face and the neck. Somebody asked me on the live stream one time whether ultrasound can see the hair. Because some women are really interested. Oh, if my baby is a girl, does she have plenty hair? Sorry, we cannot see that. We cannot see how much hair your baby has on ultrasound. We cannot see that much, right? But nonetheless, we look at the face and the neck, right? Your the reason your first of all, your sonographer will be looking for the proper formation of the face. Hey, Jody is here. When somebody asks for hair color, that is the most ridiculous question anybody will ever ask. What would you want to do with the hair color? Good evening, Dr. Jody. Good to see you. Right. So your sonographer will be looking for the proper formation of the face, facial formation, right? We want to know whether something is missing. The cleft, they want to check whether cleft palate. In some babies that are born, there is a incomplete lip, so it's either on one side or on both sides. So that's cleft lip basically. Then there's cleft palate. If you open the mouth, the top roof, the roof of your mouth, of your buccal cavity, is actually palate. In some people, it is open, and that will affect speech. So your sonographer will be looking for cleft lip and cleft palate. Besides looking at the facial formation, there's also several things that I cannot even mention because it will not be understood. Several things, down to even the eyes, right? So several things. But the ones that you can understand is the ones I'm mentioning, right? And that informs why this type of scan takes a longer time, right? So they look for that. Then they go to the neck and look for if there's any mass or fluid collection around the neck, which will indicate many things. Now, this finding is that Benedict. Benedict, good to see you. You're welcome. Now, when this examination is done to assess the face and the neck, the reason is because the findings, especially if it's abnormal, may affect the feeding of the baby after birth. Just imagine a baby that comes with cleft palate, where the roof of the the mouth is open. Definitely, it's going to affect how the child feeds, and it's also going to affect the breathing, especially when you have cleft lip, cleft palate. It's going to affect the breathing, and definitely such defects will require surgery. So the earlier it is seen in anatomy scan, the better for the preparation. Not a child being born and wow, so much surprise, and they're running up and down looking for solution. But when you know ahead of time, you can now prepare for the solution. That is one of the reasons why the face formation and the neck will be assessed. Is that clear? If you are here with me and this is clear up to this point, you want to talk to me in the comment section, just type clear, and I will know that you are still there. All right. Before we go on to talk about the heart, yeah. So type clear in the comment section. Let's go ahead and talk about the heart. I hope you know that the heart is one of the most important parts of the body. Reason why we need to talk about it, right? So nobody, I don't think, can I be heard? Can I be heard? If I can be heard, I need you to communicate in the comment section, because I'm not seeing any comments, and it means that nobody's hearing me. Okay, I can be heard. Okay, so yeah, so we talked about now let's talk about the heart, which forms one of the most important parts, right? Of course, if the heart if the heart does not even beat at all, it means that the pregnancy is not viable. You're not pregnant. Yeah. So now that it's viable, let's look at the heart. The heart will be checked for details. We check for details. He will check for the chambers. The doctor wants to see the chambers. Now, if you look at the screen here, you look at the, where's my hand now? This particular place, these two images here, yeah, is the heart. So your doctor will be looking at the chambers. Now, a normal human being should have 4 chambers. And of course, between the chambers are valves. So these are the things that will be looked at. Are they functioning well? Is the heart beating all right? Connie, several things can happen. Several things can happen. All right. There's no one specific thing. Several things can happen, and that is basically fetal demise. It's fetal demise. So anyway, so I was talking about the heart. So your sonographer, your doctor, radiologist will be looking at the chambers, right? Are the chambers complete? Are they clear? Are the valves okay? Is there even any abnormal mass inside the chambers, which is not supposed to be so, right? They'll also be looking at the valves. I just mentioned the valves. The valve is what separates the chambers, right? So they'll look at the valves, if they are functioning all right. Then they'll look at blood flow. Can you see here? Can you see here? Can you see these colors? That is done to look at the blood flow. And the blood flow will give an idea of how the heart is functioning, which is very key. And they will still also look at the rhythm. Is it regular rhythm or is it abnormal rhythm? So I think globally, congenital heart defect affects about 8 in every 1,000 births. So for every 1,000 births, 8 of them may have congenital heart conditions, right? So you see reason why your anatomy scan. In developing countries, some things may not necessarily be done the way they should, but now you know you want to take it seriously, right? Anyway, the reason why this is done is because of what early knowledge can do for you, right? No, Connie, if you just stay on the live stream as we proceed, you'll be able to know, right? Just stay on the live stream. Learn today's own first. We may get to what you're asking. We cannot speed. We cannot speed up and jump the several things. It's a step-by-step process, and we don't want to leave our listeners confused. Is that okay? So just continue with the live stream. I'm sure One of these days we will deal with these things in details. But however, if you have been here before, you already know from first trimester the many reasons why fetal demise can happen, right? But just be patient. If valuable information comes slow but steady, right? Uh-huh. So I was saying that early knowledge of these things can mean that you plan your delivery in a special center, right? Oh boy, the, my motivation for all this still boils down to one thing. I've seen people suffer, right? I've seen people suffer. You don't want to give birth to a child, and all of a sudden you are now faced with a new emergency. Maybe one thing went wrong. So you want to do your anatomy scan as early as possible. So, but if for any reason there is such situation, it means that you can plan your delivery in a special center where the case can be handled, right? And even when the baby is born, there is an immediate newborn care. So that is the benefit of doing and knowing some of these things. And I bet you, if you have the specialized or intentional newborn care, because you already know, the survival outcome will be better, right? It will be better. So that's for the heart. Is it clear? Is it clear? Type on the comment section clear so that I'll be sure you are listening. So if it's clear, let's go to talk about the lungs and the diaphragm. Now, in this systematic way that I'm taking them, it's the same systematic way your sonographer, radiographer, or doctor will be doing the same, because we don't rush this part of your ultrasound. Yeah? Steven is here. Steven, your badge is already gray. It means that it has been long. You dropped a heart, me. Yeah. Okay, so is it clear? I can't see any comments. Is it my network? Is it my network? I think maybe my network has an issue, or it's kind of slow. All right, so okay, at least I know that Nisima is listening to me. So whatever happened to others, I just hope you are learning something. All right, so let's talk about the lungs and the diaphragm. What is diaphragm anyway? Diaphragm, everybody has a diaphragm. It's what helps you. It's the muscle that helps you to breathe. One of the major muscles that help you to breathe. And it's that muscle that separates your abdomen from your chest, right? Uh-huh. So we also look at that in your baby, your fetus. We look at how the uh, lungs is developing, even though they are not going to be in use at the moment. But remember, the fetus, even though they are not using the lung, they're also rehearsing how to breathe. So most of the things that you see babies do, you wonder that these things nobody taught them. Well, they've been rehearsing for the space of time they were in the womb. So it's not coming as a surprise. So your doctor is going to be assessing the lung development. The doctor is going to look at the chest size, right? The doctor is going to look at the diaphragm position. And why is that important? Because some babies have lungs that are too small. or organs. Some organs may move into the chest, and that will cause a breathing problem eventually. So that's why that needs to be assessed so that you don't run into that kind of situation. The earlier, the better. And by the way, there are some abnormalities where the heart is outside the baby's chest, right? So if that is seen earlier, the emergency can be prepared for as soon as the baby comes, and the correctional surgery can be done, right? So that is why this matters a great deal. That's why it matters, right? So now from the lungs and the chest area, we now go down into the abdomen and the digestive organs, right? So now that's where we are. We're looking at the abdomen and the digestive organs. The scan will check for the stomach. Yes, the stomach needs to be assessed. The stomach will be seen. The scan will be looking at the liver. The scan will be looking at the intestines, right? And even the abdominal wall, right? Now, this is to confirm that the baby can swallow. Yeah, it's to confirm that the baby can swallow, the baby can digest, and the baby has the organs in the right places. Because for some people, the abdominal wall may have defect, and the bowels are actually exposed outside. So if there is a situation like that, it can be seen early enough. Right? Several things that can be detected when you do abdominal scan, right? Um, Also, a lot of people don't know that part of the swallowing is rehearsed in the womb. What does the baby do? The baby swallows the amniotic fluid. That's where it rehearses how to swallow, right? And it goes through the digestive system and the body absorbs it. All that is already being done in the womb. Then eventually the baby will pee. So the amniotic fluid is still the pee of the baby. The baby swallows it and pee it, swallows it and pee it. We're giving us an idea that first of all, the digestive tract is okay and the urinary tract is okay. If there is blockage, you could either have too much water, amniotic fluid, or too little water. Something is causing it to be too much or too little. So you can see why it's very important that scan is done. So besides the confirmation that your baby can swallow, can digest, and that the organs are in the right place, it also gives us an idea if there is abnormal obstruction through the kind of things we'll see, right? Let's go to the kidneys. The kidneys also are functioning. The bladder is also functioning, right? I just mentioned about peeing, right? If the baby is not peeing, it means there is something wrong with the kidneys and the urinary tract. Hi, this is my indefatigable colleague, the celebrity Wongoro Wongoro. Good to see you. Good to see you. Long time. Long time. And why have you abandoned us? What did we do? But compliments of the season. Good to see you. Yeah. So that's my colleague. You want to grab her? You want to grab her? She also does a lot of she goes on live and a lot of beneficial things on her live stream. So I want to grab her ASAP. Especially for those of you female that are too shy to talk to me, you can always go and talk with her, right? All right. So So, I was saying, um, I was saying, yes, part of what will be assessed will be your baby's kidney, bladder, and it's very important for their survival. Yeah, very important for their survival. The doctor will be looking at the both kidneys. We're looking at the urinary flow, right? Of course, they pee while they are in there, right? So also be looking at how the bladder fills up and it empties. So these are the things we look at because the baby's urine makes up most of the amniotic fluid. One time I told one of my patients that, you know that your baby pee this amniotic fluid and also swallow. She said, "Ew." So the question is, where will the amniotic fluid come from if they don't pee it and swallow it? And by the way, it helps with their physiology, like I mentioned earlier. So it gives us an idea of how healthy the kidneys are, and also it directly affects the the urinary system. So we look at all those things and see what's going on. So that is why you're going to be having your anatomy scan for the period of 30 minutes to 60 minutes. So do not say, this one is like he doesn't know what he's doing. That's why it's taking too much time. No, the speed of your scan does not determine how professional the person is. It depends on what exactly we are we are doing. All right, moving forward, the, we move on to looking at the spine, looking at the arms and the legs, right? All this will be assessed. Why? To confirm the spine closure. For those of us that were here when I was talking about first trimester, the things that happens in first trimester, you remember we said something about the neural tube and blah 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 blah, right? So here when we're doing the anatomy scan, we're looking at spine closure, right? We look at the limbs length, we look at the joint movement and all that to be sure, even the hand and foot formation, to be sure that everything is forming just right, the way they should. And of course, if there is any abnormality, we get to see it on time, which will give you a better opportunity to prepare for the care when the baby eventually comes. Is that okay? So that is key. So if up until this point you understood something, just communicate with me in the comment section. Type understood so that I know that you are there and you are listening to me. All right. So are we still together? Are we still here? Is it my network or people are not listening? All right, we are here. We are here. All right. So move on to the next thing. Move to the next thing. Let's look at the placenta, the amniotic fluid, the umbilical cord. All right. Salama. Salama, you're welcome. All right. We look at this support system of the pregnancy, because all this together forms the support system. Is that okay? So the placenta, we're going to be looking at the placenta location. Somebody asked me that question yesterday. What's her name now? I can't remember her name. She asked that question. She was asking for her sister, right? So the placenta location is very key. So we're going to be looking at where is the placenta located? Is it located in the front? Is it located at the back? Is it located? Is it low lying? Right? And I explained all that when I was answering her question. Is it low lying? Because she was asking about placenta previa. So we did an extensive discussion on all that, locations, and why it happens. We also look at the placenta attachments. You're right. It's part of what is going to be looked at. Then, of course, blood flow will be assessed. She asked why there is placenta previa. Yes, that was the question yesterday. And we were able to do justice to that. And of course, I told her not to be afraid of CS. Thank you very much, Omawumi. Thank you for the heartman. Now, of course, I mentioned the amniotic fluid. We're looking at, is it too little? Is it too much? If it's too little, it can mean growth restriction. If it's too much, it can signal diabetes or swallowing issues. Yeah, this is what it will signal. But several things, because I'm speaking to if it was more professional discussion, I'll go into the more details. We just know that is the reason why we look at all those areas. Then umbilical cord, yeah, somebody asked me one time. She asked, I think she had a situation before in her previous pregnancy of nuchal cord, when the umbilical cord is around the neck. She was asking, why does that happen? It's not everything that happens to you that you think is a disease or there's some kind of diabolic thing associated. You just have understanding, right? Anyway, so when we look at the umbilical cord, we're looking at whether the vessels within it, they are complete, right? We're looking at the vessels. There are 3 vessels. We look at the vessels, we look at the blood flow through the umbilical cord. We look at the way it is attached and whether it's properly attached. So this determines how well the baby is being nourished. All this information about the umbilical cord gives an idea how well the baby is being nourished, right? Then after doing all that, the next important thing will be the part that most people are more most people do focus on, right? Look at the growth measurements, right? Look at the growth measurements. Look at the baby, whether the baby is on track or something else. So your doctor will be measuring things like your baby's head, just like taking your child for, you want to sew clothing for your child. You take the child to tailor for measurements, right? So we're going to be measuring the baby's head. We measure the baby's abdominal circumference, fetal length, and all that. The reason why all that is done, we use that to compare, right? These numbers, we use them to compare the gestational age and actually what we call the global growth chart. So this is where we can now assess whether there's a growth restriction or this baby is too large for the gestational age or too small for gestational age. If you have heard a big baby, small baby, or macrosomy before, this is where we get all that information from. So the goal of this is balance. The goal of it is balance. So if it's not balanced, we will definitely know that it's either big or small, right? So this anatomy scan save lives. Basically, it does save lives. Christy label is here, right? So now, I think that the global data or the global view to this shows that over 50%. Good evening, Christy Labor. Good evening. Over 50% of major structural anomaly are first detected at this anatomy scan. See why it's important to go for anatomy scan? An early diagnosis would actually reduce the newborn death or even complication. Why? Because you've seen it ahead of time. You can plan the care and also improve the outcome dramatically. Yeah, that's why this is important. I think in many countries, this can actually reduce preventable deaths by more than they say 30%, but I think it should even be better than that. Why? Because you have seen what you need to see before the baby comes, right? So is the scan painful or dangerous? Somebody asked me. So if you say I should go for anatomy scan, this one, is it going to be painful? Has it ever been painful? Has scan ever been painful before? No, it's not. It's not painful. Why? Because ultrasound, like the word sound, it uses sound waves, not radiation. Somebody came to me one time and said, Doctor, they said that too much scan can affect the baby. And the question I asked was, the person that told you, is the person a doctor? Right? So that's where we should start from. Interchangeably used, Stephen. They use it interchangeably. Even though at 13 weeks you can also do anomaly scan. All right, so it's not painful, it's not dangerous. It's the use of sound waves that we're using to produce all these images to see if there is any defect or if your baby is normal. So it's not dangerous. It is safe both for mother and for child. It's safe. And I said it before, this scan will take quite some time, 30 minutes to 60 minutes. So you should not be in a hurry to go anywhere because it's a very meticulous, careful, systematic examination, inspection of your baby. Edo finest, you're welcome. And sometimes it even takes longer than the time I'm mentioning, right? So you should be prepared, right? You should be prepared because if you have to go for that, just be sure that whoever is handling that for you is very meticulous and not right. So sometimes when it will take longer than necessary, it may just be because maybe the baby's position is making it difficult to visualize some things, right? And some structures may not be clear enough. So we want to take some time to look around and be sure that we have actually seen all there is to be seen. So patience will improve the accuracy of the outcome of your scan. So if you know you are always in a hurry when you enter the scan room, well, it's to your disadvantage because in the end, the individual handling your professional will not be meticulous enough. As I'm talking to those of us in Africa, because I know that to some extent, those outside the country may. Oh yes, all it comers. You, I don't know whatever you missed, but you did miss something. Well, long story short, your patience will improve the accuracy. So do not rush your doctor to anywhere. I used to tell my patients, if you're in a hurry, please come back tomorrow. There's no need to be in a hurry, right? Why do you put pressure on me? And in the end, if you don't get the kind of results you want to blame me for not being meticulous. No, it's on you. So you want to come back tomorrow or be patient. Is that okay? Yeah. Good enough. If you do this type of ultrasound scan examination and everything is normal, it brings you reassurance. It brings you reassurance. It actually will reduce anxiety, right? It will confirm the healthy development of your baby and allows your pregnancy to continue with some level of confidence. For many parents, this can transform their fear to joy because a lot of people are actually coming to the examination room with a premonition. But when everything checks out right, you are facing your pregnancy with some level of confidence and gusto, right? So that's why it's very important. And if for any reason something goes wrong, at least you know it early. If something is wrong, at least you know early. Your doctor can now plan ahead. You can prepare yourself emotionally and medically. One time, oh boy, I've had several situations like this. There was one time years ago. I was working in a particular place, and there was a situation where these patient, I think the fetus had a one limb was shorter than the other. And when I sent that result out, they queried it, right? They queried it. They went somewhere else. Whatever result they got there. So, but again, I did several follow-ups on that. And in the end, it turns out a delivery to be so. Now, if this kind of diagnosis is done early, what happens is that it gives you a foreknowledge to prepare. Unlike the sudden emergency that comes and now you are confused where to go to handle your situation. So your doctor will plan ahead. You can prepare yourself medically and emotionally to see your baby that is having some issues. In some cases, the treatment may even start before birth. In some cases, so knowledge is not bad. Is not bad news. Knowledge helps you to treat your ignorance long before time. All right, so we are close to the time we begin to take questions. If you have questions, we are very close for you to take questions. So I just want to say quickly, in the simplest possible terms, that anatomy scan answers one big question: is my baby growing the way that nature intended it to grow? Right? It may not be. This anatomy scan is not about perfection. It's about preparation. So if your baby is growing the way it's supposed to grow, you prepare. If it's not growing the way it's supposed to grow, you prepare. So that in the end, you don't find yourself in a very confused situation. Is that okay? So I want to stop here for today. So if you have a question, you have something that's bothering you, you want to send a request, come up, let us answer your question tonight. Thank you very much. Okay, just a quick one. 25th of December, that is like 2 days away. Okay, that is Christmas evening, 7 p.m. Nigerian time. We'll be discussing, you want to join me? We'll be discussing the effect of sugar on male and female fertility. You don't want to miss it for anything. You don't want to miss it. 7 p.m. Nigerian time. You don't want to miss it. So you want to join me by that time. In the stretch, muscle the man, half the ball to the very end. Placental, twist that sheet, nobody that want to be deceived. Breathing deep, she's so sweet. Nighttime dance go keep you fit. Thank you very much. Oma with me. Chrissy Label, that is the question a late comer will always ask, because we said that from the beginning. All right, it's anywhere from 18 to 22 weeks of pregnancy. Is that okay? 18 to 22 weeks of pregnancy. Almost like a lullaby. Even when blankets wrap you tight, your body that fights through the night. When morning comes, you rise again, strong like lion, free from pain. The body they rock, enough you play. The body they rock, the body they rock. Toss and turn, twist that sheet. The body they walk, the beat the seat. Breathing deep, dreams so sweet. Nighttime dance go keep you fit. Oh, oh, oh. You're just joining, you're welcome. It's almost time for us to go. So we have a few minutes to take your questions. Somebody was asking question earlier. Was what? What is what? Cause of what? What is the cause of what exactly? No, I want to be sure what you're asking. If you have a question, please send your request and come up. Otherwise, it's time for us to go. What's the cost of anatomy scan? No, it depends on the facility and your location. So there's no universal cost everywhere, right? So it depends on where you are, your facility, depends on your location, right? All right, if there is no question, it's time for us to go. Keep on moving, keep on strong. Nighttime cast they carry you low. I go down so. All right, guys. So see you guys tomorrow. We'll continue our gist tomorrow. However, don't miss Christmas night discussion. Christmas night episode. You don't want to miss it for anything. Christmas night, we will be discussing the effect of sugar on male and female fertility. By that time, most of you would have taken sugar, so we definitely going to be talking to you about it. So Christmas night, 7 p.m. Nigerian time, we will talk about it. God bless you. Make sure you have a good night's sleep. See you tomorrow.